Breaking news from KHON2, happening now.
Thank you for joining us. We have our first case of COVID-19, the coronavirus, here in Hawaii.
And good afternoon, everybody. Howard Deshefsky along with Gina Mangieri. The state health department got a positive test about 2 hours ago. They alerted the public 90 minutes after they first learned about it. We want to get right to the basic information. We have Dr. Josh Green, the state lieutenant governor, who also heads up the COVID-19 task force here in Hawaii. Doctor, thank you for calling in. We'll get to you in a moment, but just first, Gina, let's go right down the list of the basic highlights and headlines as we know it.
This is a man on Oahu and living on Oahu who was on the Grand Princess cruise from February 11th to the 21st, disembarked in Mexico, flew home asymptomatic.
And then when he came home, it was a matter of hours or days. Maybe we could get a little bit more on that information where he started feeling sick. He immediately called his doctor. He went into seclusion. So the good news is it's not community spread. We can connect the dots. We know he was on that ship that returned back to San Francisco and then eventually came here to Hawaii, where it made 4 ports of call. We'll talk a little bit about that in a moment, but if there is a little bit of a silver lining, 1, we know his travel history, and 2, as soon as he started feeling symptomatic, he went into self-quarantine, where apparently he's had 0 contact with anybody else.
And one of the state's foremost experts on this is our Lieutenant Governor and Dr. Josh Green, joining us from phone now. Doctor, please give us your thoughts on this first case coming as a travel-related case from a very conscientious citizen who did all the right steps. Dr. Green.
Well, thank you. I think this is a great example of someone taking personal responsibility. I'm personally appreciative that that gentleman self-quarantined. That's what we do hope and expect out of people. Of course, the fact that he's ill, we want to make sure he's going to be okay. But once we got the test, we also wanted to make it clear we would communicate immediately and directly with our entire state. And that's what Department of Health decided to do and the governor decided to do. Now, this person was probably only infectious once he got symptomatic. That tends to be the case. So viruses are most symptomatic when you get deep into it, 4 or 5 days, and then they are most infectious when you have fever, cough, runny nose. So hopefully he did not really expose anybody else, but we're still going to be very careful and follow up any potential leads.
Doctor, let us ask you, too, now, this cruise ship situation is growing by the day. At this point, 21 people from this Grand Princess cruise, 19 crew and 2 passengers have tested positive outside of Hawaii. That's what made this man call into his doctor and say, you know, I'm feeling sick, sort of mildly sick, but, geez, I was on this cruise ship. This number keeps going up. Can you speak to cruises in particular and the risks they pose?
I can. And keep in mind, I believe the number was over 700 people by the end of the count when the Diamond Princess became an infectious ship. So these cruise ships, and we all love cruise ships to a degree, but I think it is time for us to get serious, and we are going to have to encourage a pause, I believe a 60-day pause, until we can find out whether or not we're able to control infection of coronavirus, COVID-19, on cruise ships. I think that they will lean that way themselves. I think the federal government, in fact, I know the federal government in their task force that's run by the vice president are already considering action for cruise ships and advice. But I think it doesn't take a genius to see that we are now exposed to a new risk, and that's been people infected on cruise ships.
Well, the governor made the point that they do not have the jurisdiction to stop the cruises from coming here, that's Coast Guard, but that becomes federal, and you just kind of spoke to that. Let's go back and talk a little bit about this particular ship. The man was on board from San Francisco as it traveled down to Mexico. He disembarked there, flew home, apparently feeling fine. And we should also point out he's doing very well right now in isolation at home. That ship then returned to San Francisco before coming here to Hawaii. It made 4 ports of call between February 26th and February 29th on Maui, Oahu, Hilo, and Kauai. The state says that they have a bit of a manifest, but 3,500 people on that ship, some of them we couldn't probably say symptomatic or not. What about these people that got off and traveled around and went and ate at restaurants, shopped in stores? Is this something that now we got to sit here and kind of wait out to see if all of a sudden there could be something much bigger on the horizon here?
Yes, we do. In all of these areas where people disembark from the ship, it will be too many individuals to track all their contacts. We'll do our best. But if anybody in these areas, especially like where I came from, for instance, Kona, when cruise ship passengers got off the ship, they would go to multiple stores and multiple restaurants. Let me reassure people, it is very difficult to contract COVID-19 from a casual contact with an individual, especially if they're not severely symptomatic. It's not impossible. If people get symptoms, which is sore throat, fever, or shortness of breath, or cough, and you're in the community, please call your provider. We will give you the best advice and likely a test. We have to up our game on testing, and this is going to greatly accelerate our testing in the community. But if you have those symptoms, don't rush straight to the emergency department. Remember, 80% of the people across the globe who have gotten COVID-19 have had very mild symptoms. However, if an individual starts feeling severely short of breath, go to the hospital. That's the time when you have to go get care immediately. That's where we can test you also immediately and figure out within, if you're on Oahu, 4 to 6 hours, if you're positive, a little longer from the neighbor islands. I think we're going to look at a lot more tests in the coming couple weeks. Meanwhile, we're accelerating that capacity through our private labs. So we've been preparing for this moment, and I know people are a little bit scared, but please realize there are going to be very few cases overall, and very few people, unless they were badly symptomatic, would have spread it to you.
And what we're looking at on our screen now, Lieutenant Governor, is a map, the Johns Hopkins map of cases. Hawaii has not been on it. We got our dot today, so to speak. I'm glad to hear you mention upping our game on tests, because the governor spoke today, this afternoon, saying we have only done 8 tests in Hawaii since Friday. 8, despite having the capacity to do 250 a week or 35 a day. And while those numbers may seem impressive, keep in mind that a state like California has the capacity to do 6,000 tests a day. A state like Washington has the capacity to do 1,000 tests a day. Lieutenant Governor, what will it take for Hawaii to go from being the state with the very lowest capacity to test to join these much larger, more active states?
Well, as early as 4 o'clock this morning, I was in communication with our private labs. We are also giving them the information, the contacts with the White House to get activated so they can run private tests. The private tests are exploding all across the nation, and that will mean that in the coming days, we will be able to do these tests through clinical labs and diagnostic laboratories and Kaiser. It just takes a little bit of extra paperwork, and they're going through that right now. They get internal validation, and then they'll be able to test. And we've discussed this, and we all agree that's important. We also have to max out our, at this moment, we've been described as 250 tests a week. We also believe we could get up to 500 a week if we really, really hustle. And it appears that we really, really need to hustle. That number is okay because we have 2,000 tests in state right now. But in the coming days, as you can imagine, private industry is racing to get to the capacity to test hundreds of thousands, if not millions of Americans. And that is going to be both important for confidence and for reassurance for people, but also obviously to test people if they're actually sick. So the actually most sick people, the state lab will do all those tests. But then all the rest of the people somewhere on the concern spectrum, from colds, flus to COVID-19, I also believe we should start testing.
All right, yeah, the governor said that right now we haven't been, or Bruce Anderson, not going to cast a wide net. We need to save these tests for those who are highly symptomatic. I want to go back and talk about something you mentioned, the CDC, and out of Washington today. A lot of bulletins about people kind of, what do they call it, social distancing. You said there's not a huge concern, assuming we all kind of mind our P's and Q's and wash our hands, do all the right things. But for people that are a bit concerned, we have a volleyball game at the Stan Sheriff Center, a sellout tonight, 10,000 people. What is your recommendation? And also, you know, the one thing that we kind of, it's a word that I don't know how we could translate it, but they say the elderly, and they use that number 60. Well, there are people that are 50 years old that seem elderly. There are people that 70 that are strong as bulls. So what is your recommendation, and what should people do? Because, again, we don't want to alarm people. We don't want people to think that I need to lock myself in the door, and that's why I went out and bought 47,000 rolls of toilet paper.
Yes, I would say this. If you were thinking about going to the game tonight, go, but do not go if you are sick. If you have any symptoms, sore throat, shortness of breath, fever, any cold-like symptoms or flu-like symptoms, simply do not go to events like big sporting events or fairs, festivals. Do not travel. Do not go to work if you have those symptoms. If you're feeling fine, go. That's totally fine. I don't want people's lives to change too dramatically. If they're not symptomatic, they're not spreading the disease. Having said that, people who are elderly, and my general definition of elderly is over 75, that's when we see the curve change and people getting much more susceptible to serious illness and dying from COVID-19. That's the time you might be a little extra cautious. So if you are more senior, over 75, or if you have chronic lung disease because you've been a heavy smoker or you have chronic lung disease or heart disease, those are other considerations to be a little bit more careful. Again, we only have one case in the state. We probably have additional individuals that have been exposed, and we're going to make sure that people get good care at our hospitals. But I don't think people should panic. I think people should realize, sure, this is a lot more serious than the flu, but it is not something that we have to worry is going to devastate our state as long as people stay calm and are responsible.
And doctor, isn't the severity, though, sort of skewed by the fact that testing is only being done of the most severe patients? Might this pan out over time to be something a little bit more mild, or at least what the numbers are in terms of its fatality rate? Our fatality rate is being calculated based on the most sick people being tested, and among those, how many lived or died.
Yes, absolutely. The current mortality rate based on those calculations is about 3% mortality rate. It's going to drop very significantly. There are surely hundreds of thousands of additional people across the globe that had very, very mild symptoms and did not get tested, and they certainly did not die. So in the end, it's going to still be more lethal than the flu, which is only 1 out of 1,500 people passing away. It's, however, not going to be anywhere near the 3 out of 100. I would guess ultimately we're going to see it something about 1 out of every 200 people get this virus and succumb to it. We'll wait for the epidemiologists to do the final tally by the time this ends, but it's not as lethal as we're currently calculating. People have to realize that there are many, many people out there that barely even knew they were sick and probably were carrying the virus in China.
All right, good point there. And one more thing, if we could ask you to speak to, is Bruce Anderson mentioned the fact that there's approximately 90 more people throughout the Hawaiian Islands right now, whether probably all of them, again, you could connect the dots probably to travel, but 90 people that are in self-quarantine mode, taking their temperatures twice a day. The state is in constant contact with them. Can you speak a little bit about how those people are doing and what are some of the protocols that they are following? And again, so that if anybody else who's listening that starts to feel symptomatic, what should they do and kind of go down the checklist, what you want to see from these people?
Well, yes, the people who had a travel exposure and a travel concern went into 14-day quarantine at home and are being followed by Department of Health. If they become symptomatic in any way, we will test them. At this point, it is obvious that we have to be testing more people, especially if they have any concern. But the good news is we've had many people come through this process in 1 day, out 14 days later, and they have not converted to positive. None of them have developed COVID-19. So the Department of Health has worked really hard to track all these individuals. It's something that was not possible in New York or California, where they had thousands and thousands of individuals. I will say this. We have to change our threshold, just like the federal government changed it on Monday when they changed the parameters for testing. We're going to test more people, and as the governor pointed out very appropriately, we have to get some sentinel testing out there, which is tests to see if this virus is in our midst and we don't even know it. I'd like to see us get many thousands of tests done, and that's going to require, again, the private labs doing some of the testing. We're on the precipice of that, and people are working very hard behind the scenes that you guys trust to get that done.
Dr. Green, I'm glad you mentioned Sentinel survey testing. Dr. Anderson spoke at the press conference saying that as of next week, they had planned to roll out Sentinel survey testing of up to 200 people, again, meaning are we missing some unrecognized COVID-19 in the community? This would be testing to see if the virus is circulating in the community. There's one patient first that we have now is not a community spread, it's a travel spread. He did say that Sentinel survey may be delayed past next week. week due to today's positive test. But you mentioning that Sentinel survey again brings up the question that many of our viewers ask us is, well, wait a minute, how do we know that the just mildly sick are, you know, a flu versus a COVID? So that Sentinel survey is very important. Also, Lieutenant Governor Josh Green also mentioning some very, I'll recap, sir, what you mentioned, some very progressive, some very bold initiatives. You suggest 60-day pause on cruises should be looked at by the federal government. Also, Lieutenant Governor recommending change that threshold for the testing, get away from this very narrow definition that the CDC is holding people to.
Well, I think he talked about, and I know you're still listening, Doctor, and thank you for being with us, that only a handful of people tested here. If you look at it as a national level, the U.S. as a whole has tested something like 1,500 to 1,800 people. South Korea, it's 160,000. And as you said, as a result of that, the fatality, the mortality rate is well under 1%. So I think ramping it up is key. I want to ask you one more thing, and I've heard people wonder and express concern about this. Because of our isolation here in the middle of the Pacific, could you see any possibility, and I know you would fight it tooth and nail, is somebody saying all these cruise ships, maybe we should send them to Hawaii, and maybe that's a perfect place to kind of isolate them from larger populations. Any possibility of that happening?
No way. We'd activate our National Guard and our Coast Guard, and we'd stop everybody. I hesitate to say we'd use torpedoes, but there's no way on earth we could do that.
Good to hear.
Short of torpedoes.
Yeah.
Well, Dr. Green, thank you so much for your time and attention to this, and he will be joining us when we air on Monday, Coronavirus Fact, Not Fear. You will be our leading panelist, sir. We look forward to seeing you here on Monday when we tape that, a very special half hour dedicated to separating rumor from reality and making sure we give people only the facts they need to know to keep them and their family safe. Again, that will feature a panel of medical and travel experts to cover the current scope of this virus, precautions you can take, those underway in the business community. And Dr. and Lieutenant Governor Josh Green remaining the state's point person on this. Thank you for joining us.
Yeah, we appreciate your frankness and your transparency. You've been out there from day one, and I know that you believe that's 100% critical.
It is. People need to feel comfortable we're doing the right stuff.
Well, right on. Thank you very much for your time. We appreciate it, and all the best to you, a very busy man who, of course, still an emergency room doctor, lieutenant governor, and now heading up the state's efforts on the COVID-19.